Hello everybody, Andrea Twarowski here with Dentalelle Tutoring. Please excuse the mess. We are moving shortly, so my office is a little bit crazy at the moment. So I've been tutoring now for about 13 years online and I love it. So I tutor dental hygiene students and dental assisting students. And students all love mock exam type questions. You know, if given the choice, students would prefer to just sort of go over mock exam type questions opposed to reading over a textbook, maybe listening to a lecture, reading notes, reading modules. Everybody likes mock exam questions because you can kind of focus on one thing and then really determine if you know it or not. And I prefer to go through multiple choice questions because that's what you're used to in school and that's what you need to get used to for the exam as well. So I do try to teach my students the right way to answer the questions and how to look at all of the answers, because two answers are usually correct, but then you have to determine the most correct. So I do teach students how to do that over time because it is a process and it does take time. If you haven't looked at the full board exam prep academy yet, you should, because that's something that I do offer for my dental assisting students and dental hygiene students also, where I go through the full course to help you study for the board exams. So you get modules, you get mock exams. We do some live tutoring about twice a month every Sunday. You get lecture videos, you get tons of stuff. So please have a look at that if you haven't yet. But a little kind of look inside one of our live sessions is I like to go through a mock exam type questions. So let's do that now. So let me just share my screen here. And in this video, I want to talk to you guys about seniors and special needs. So every time we have kind of like a live tutoring session, I did have a textbook here actually, but now I think I left it downstairs, but that's okay. I don't really need the textbook here anyway, but every time I have a live tutoring session, we have a session for about an hour where either I lecture on a topic or we talk about mock exam type questions or a little bit of both. So, and I like to focus on a certain topic. So I'll talk about oral pathology the one Sunday, or we'll talk about seniors another Sunday. We'll talk about special needs. We'll talk about anatomy, so I like to mix up the topics. So this slide actually has this PowerPoint has about 31 slides. So we won't go through everything, but I will go through some questions with you, and then that way you can see if you have a good take on seniors and special needs. So let's talk about some popular questions. So, okay, so this one I love to talk about because this is even something I feel you should know for the real world. So when you start to talk to patients, seniors specifically, because this is kind of where this question comes into play, it's nice to know certain numbers. So this question is asking about demineralization. So when does this occur? So your pH levels in the mouth have to reach a certain point for this to actually occur. And if you remember, I think I have an image in the next slide, but the lower number is acidic. The higher number is when things are more basic, more good, I guess, for lack of a better word, for the mouth. Anything too acidic causes demineralization, and that's not good for the teeth. So do you guys remember what that number is? And this is something that often people forget about, so that's why I like to talk about it. So if you need a couple more moments to think about it, feel free to stop the video, but I will go over the answer now for you. So the answer is 5.5. Now you have to keep in mind that the number of 7 is neutral. So that's the number that is a good thing to have. Like I'll talk about this a little more later on, or probably in another video, but you have to tell your patients, or you should, I say, I mean, you don't have to tell your patients anything, but you should explain this acidity process to them. So let's say every time they have a soda, if they have a can of Pepsi, a can of pop, that's very acidic. So that is actually causing that acid attack inside the mouth. But what I tell patients is, because we can't be perfect all the time, is have a cup of water and just sort of swoosh it around and then drink some water also. That has a pH level of 7, and I think it even says it here, but it might be kind of hard to see. So that has that pH level of 7. So that neutralizes everything right away. So that acid attack that was happening inside your mouth as soon as you had a sip of pop has now been stopped because they had water. So those people who just sort of sip on pop all day, they are constantly having that acid attack, and that's not good. That's what happens when people get a lot of cavities. They have too much acid in the mouth. But if at the very least they're able to swoosh around with some water after every sip, that stops the acid attack. So those who come in with a cavity or 2 or 3 every time they see you, they are likely doing something wrong, and it's usually too much sugar. So at least tell them, you know, you're only human, you can have that pop, but either have it all at once so it's not as much acid in the mouth like throughout the day, or at the very least always have water with you so that's less, you know, acid that attack inside the mouth. But the question wasn't really about acid attack, so I kind of got off topic, guys, sorry, but I just wanted to mention that. So the question was about demineralization. So as soon as you see that, the tooth is being eaten away, for lack of a better word, and that's what causes cavities. So that happens with a pH of 5.5. So that's not as low as what people might think. So how I like to talk about it is, like black coffee, and I think it even says it here, has a pH of a 5. So technically and hypothetically, when they're having that black coffee, that's an acid attack, and that's eating away at the teeth. So it depends on the pH level. So sorry again, I kind of went off topic, but I hope that that helps to explain it a little bit easier for you. Let's go to another question here. So along with acid attacks and talking about pH, I like to talk about saliva because that all plays a role, because all of us have certain proteins in our saliva that are good for us, bad for us. It's kind of a mix, right? So this question is asking something about saliva. So, so what does it do? Does it aids in remineralization of the teeth? Does it provide buffering? Does it produce an antimicrobial activity, or all of the above? So you have to know what all of those mean to be able to answer the question. And if you're looking at those and saying remineralization, what does that mean again? You know, that's okay if you don't know, but that means you need to stop and look back in your notes and learn what that means, and then make a side note for yourself. And a nice thing that I like to help my students with is, let's say we are going through a live session and I'm asking questions. If somebody's not sure what something means, well, then I can help them, like right then and there, so that they don't have to waste their time looking in the notes, you know, trying to find it. It might take a half an hour, it might take an hour. Whereas if you're part of the live session, if you have a question, let me know, and then I will actually stop and help explain it to you. So it's much easier, it's less stressful, and it saves you guys a ton of time. So anyway, we'll talk about the answer now. So if you're not sure, stop the video and think about it a little bit, but I will explain it right now. So it does all of the above. So the nice thing about saliva is it does help to remineralize the enamel. So, and a good way to explain this is, if a patient does not have a lot of saliva, that's not a good thing, because saliva actually helps them sort of cleanse the mouth, so that any acidity, any of those acids that could be, you know, hanging around on the teeth, if you have more saliva, that's actually helping them. And well, it does all of the above. So if you guys have any questions about that, let me know. But I did leave a side note saying that a lack of saliva means xerostomia. So this is a number, or a name, or not a name. It's a word that as a dental assistant and a dental hygienist, you would know by now. Unless you're a new student, then you wouldn't really know what that means yet. But you will hear it often, and once you start working in an office, you will hear this term all the time, because seniors especially, they tend to suffer from this. As we get older, taking more medications, if we have to do that, a lot of medications cause dry mouth, also known as xerostomia, lack of saliva, so that's not a good thing. But on another side note, which I should just put a few stars here, if a patient for whatever reason just has too much saliva, then you could be taking a medication to actually stop that, called pilocarpine. Now, I've never heard of anybody actually taking this because I don't know anybody who would just simply have too much. The only thing that I can think of is, let's just say you needed to work on a tooth, like a tooth way in the back. They needed a crown and they just had so much saliva that you couldn't do a good job because they have so much saliva. Then you might put them on this type of medication to help to limit it a little bit. But I've been in practice now for 13 years and I've never heard of anybody actually doing this because typically somebody doesn't have that much, right? So if you guys have any questions about this one, though, let me know. Let's go through another question. So, what is not a retentive carbohydrate? And you might be wondering, why are you asking this in the seniors and special needs section? Well, because a huge part of that is nutrition. Because seniors, you know, depending on if somebody's taking care of them or not, they might have a different type of nutrition than what they're used to. They might not like certain foods, so they only eat certain types of foods. And again, if somebody else is just taking care of them, they might not be feeding them the healthiest of things. Or I know the ones that I know, like my grandma, she loves sweets. Like I will turn around and she's eating like chocolate. I don't even know where she gets these things from because she really shouldn't be having too much sugar because she's been a diabetic since she was like 35. And she's always been so healthy, but now in her older age, I don't know. She's acting more like a kid than ever. She's actually pretty cute, but she really shouldn't be having certain types of, you know, things, right? So that's why this is in there. Again, I'm going off topic. I'm sorry. But anyway, so what is not a retentive carbohydrate? If you don't know this, look in your nutrition unit or sign up for the full Board Exam Prep Academy because I can help you. Okay, the answer is milk. So let's look at the question again. What is not a retentive carbohydrate? So all of these other ones are a retentive carbohydrate, but milk is not. Okay, let's go through one more. So which vitamin is not fat soluble? You have to know which ones are and which ones aren't. I know, I think it's silly because in the real world you don't have to know this, but for any of your exams, whether you're a dental assistant or a dental hygienist, you will need to know this. So what do you guys think? And this is also from your nutrition unit as well. It is C. So the water-soluble ones, though, are A, D, E, and K. So that's something to make note of, too. So let me just go through that one more time. Sorry. So which vitamin is not fat-soluble? It is C. So the rest are, okay? But, oh, yeah. Sorry, I think I read that wrong. So vitamin C is water-soluble, so not fat-soluble. Okay. Okay, so last one here, guys. So glucose is the sole energy source for, what do you think? Any ideas? Let's talk about it. So glucose is the sole energy for the brain. A lot of people think the pancreas for some reason. I've heard that a lot. But no, it's the brain, okay? So glucose is the sole energy source for the brain. So if that's not being absorbed properly, if it's not being used properly, your brain can't function properly. So that's why that's so important. So yeah, you guys, so I hope that helps. So I talked about seniors and special needs a little bit for you. Some mock exam type questions. I did go off topic a little bit talking about pH, but I find, you know, even if you learn in school, you probably don't fully understand it until somebody explains it to you over and over and over again. And sometimes just people have a certain way of explaining things. So it's nice to kind of have an idea. So if you guys have questions or need help with anything, please let me know, and I'll see you guys in the next video.